to a point where we can start thinking a bit more profoundly and how to be as efficient as possible and usually the time that we have, which is going to be a little less than an hour or a little bit less than 90 minutes, right? With that, when somebody comes to us with issues, they say they hurt in a particular area. It's a shoulder related issue. I can start identifying what's happening there regionally, but then what are other areas of the body where there could be correlations? All of the goal being, as I'm doing the full body routine, how can I, as I move to other areas of the body, be focusing my attention towards the desired result related to the symptom, right? So we're dealing with a left shoulder issue. What could be the correlations of that same side elbow and wrist? What would be the correlations on the opposite side shoulder and arm? What would be the correlations further down the body and the kinetic chain? All of that. And then once we're there, it's a good place to visit some of the most important elements of the anatomy, and when symptoms tend to manifest in these regions, what are at least my tips and tricks, and take any tips and tricks you find, but where are the commonalities of treatment and intervention that tend to get you results? And I'm going to be starting off usually with when you have clients, what are your first steps related to interventions that are going to be plenty safe to do and will likely start pushing you in the direction of getting the results. And then once you're past those first few sessions, the assessment process and the trial and error of recognizing whether or not what you've been doing is actually helping or not, will start guiding you further to getting more and more precise. All right, and then we're going to work our way from the distal appendages to the core of the body, and that's how we'll work it. Naturally, though, the biggest distinction between the arm and the leg is which one tends to be weight bearing. So related to kinetic chain and the effects of one part of the body distorting and causing issues in the other, the most common problems will be from the feet up the spine to the head, and potentially shifting the orientation of the shoulder, like posture, like scapular orientation and stuff like that. But it tends to be, if it's related to a distortion causing postural issues from somewhere else, it tends to be that the scapulas get offset, and because the scapulas are offset, now that glenohumeral joint is not going to be in the correct orientation either. As massage/manual therapists, though, keep in mind that as soon as you have these joints stacked, now you have it in a closed chain. So the way you're using your elbow is going to affect how the wrist is oriented. The way you have your wrist oriented is going to affect how the elbow is stressed. The shoulder is the biggest one you really want to be aware of while trying to deliver more effective force here, which is going to be typically not letting yourself get too stuck into this externally rotated position or too internally rotated. The shoulder joint is going to be happiest somewhere in between, about 45 degrees internally rotated. Then your application here, while delivering the pressure, not letting yourself be too abducted or adducted. You should just be here, so your application, your contact point, should pretty much be in line with one side of your chest. Not over to the sternum, that'd be too far. And if I go to where it's this is one distinction with the biomechanics side that's important. If I just do this, my contact point is over here. My body weight is falling more central. So it has to come in just a little bit. Here, no. Here, yes. Here, no. Here, yes. Line right here. It's like with the eyeball that you're working. It's my right hand with my right eye. Left with my left eye. Wow. Now, that's going to be when I was talking about the differences. your upper limb is naturally going to have a lot more mobility and less stability. The lower limb is going to have less mobility and more stability. So the structures themselves, the jointed structures, are going to have typically less range, ideally should be a bit more stable by comparison. One mild exception to that rule will be the elbow because of its true hard end feel and hard stop. But much of the way the body is designed is so similar. From the skeleton and bones, you have on either side, you have digits, small bones, so carpals and tarsals, two bones, tibia, fibula, radius ulna, one bone, a femur or a humerus, and then some elephant ears, the pelvis or the scapulus. I mean, it's the correlations are so close. It's very cool. The distinctions, though, are how much mobility occurs in each one of these. And so naturally the fingers have more dexterity than your toes. Some people might be able to, have all that dexterity with their toes. I wish I did. And having more, training your toes to be able to do a variety of actions is important. So something like in longevity and what we replicate in the body can be, do we think about moving these digits? Now, that's going to also apply to self-care, but during massage, are we, if there's issues here, naturally you should try to incorporate this all the time, but time management wise, I'm trying to also be aware of just where sometimes you'd focus, right? If it's a finger to hand or a toe to foot and ankle related issue, then you do need to make sure you start, well, not necessarily start, but you pay really close attention to the digits themselves and the actions that they have. So with the fingers, their unique element is they can do these appenance actions. So there's a lot of tendency towards the tightness that occurs in these muscles here. As a group, the pad of the thumb muscles are the thenar group. Over here by the pinky, the hypothenar group. Those muscles would be called like adductor something, pollicis or digiti minimi. It tends to be your hack because that's usually what's moving here is the pinky, digiti minimi, or pollicis for the thumb. I remember pollicis for like holding on to a pole, like a ski pole. What's nice is that digiti minimi is the same. Digiti minimi for the pinky toe or the fifth phalange or fifth metatarsal, fifth phalange or fifth metacarpal, digiti minimi. Pollicis versus hallicus. And then the rest, like you have a unique element with indicus, but that's not too bad when you hear that. So indicus also has some of the abilities to pull these actions off. I mean, all the fingers can do it, but with these, they're not really doing anything special. The thumb is coming over and coming into orientation with it. But the indicus has some unique muscles. Your second phalange does not have the same. But in terms of function, when we walk, it's the second and first phalanges, your big toe and your second toe, that are actually the most important for the push-off phase. If a person can't step in such a way, and without bringing my foot up here, where their big toe, I have to pretend this is my big toe and my second toe. If I can't roll over those effectively, and especially push off with that second toe, the gait action is less efficient. With the hand, it's a case where just when we're working here, and we'll look at some more efficient ways of doing it, but can I coach a person to incorporate some of these actions so that we're getting more of an effect on those specific muscles? My girlfriend is a sign language interpreter. That's a lot of unique motions with the fingers that when it's been a long day of doing that causes tensions here. I don't ask her necessarily to spell out the alphabet. I just, when I'm working here, either I have to get precise and use digits. Usually I'm using a soft fist and prone. Hands here, and I have my fingers underneath this side of the thenar group, and I use my knuckles of the soft fist to come over on the other side. And just sandwich this structure here. I don't usually pinch like this. I'm using this to create that pinching action. Okay? But once I'm there, then I just say move the thumb towards your fingers, away from your fingers. Try to touch your thumb to your pinky finger. Now open that back up. That's usually all I really worry about. Or it can be play the piano, but thinking adduction, abduction, flexions and appenins, extensions, right? Especially that, opening the hand up. In terms of what the hand and the wrist tends to get stuck in, it's here. Many repetitive stress-related issues, whether it be carpal tunnel or others, will be somebody having to hold something or repeated flexion-based actions with their wrists flexed, and then it gets way worse if there's a twist action on top of it. So a mechanic, cosmetologist, dental hygienist, there's a whole about fellow massage therapists that aren't using they should be using their hands less. But once you're here, incorporate those actions. That's really the only hack there is there. Getting to these structures isn't particularly hard. In terms of the individual fingers, my quickest hack there is kind of a golfer's grip. So it's these three fingers where you're going to have the best squeeze potential. Now, if squeezing hurts you to do, then you have to find some other action of doing this. One could be, if you wanted something that's best for somebody's hands, wax paraffin dips are a really good treatment for all things hand and fingers. They're particularly good just as a symptom management thing. It's not going to cure anything. But for like rheumatoid arthritis and things that might cause you to be more cautious while working here because the joints are really inflamed. But as that wax hardens, it's squeezing all the tissue. It's like doing a nice lymph drain. So even if it isn't lymph, it's helping with like accessory inflammatory fluids. That's a thing you could incorporate versus you doing it manually. If the squeeze action hurts you. It's these three fingers. You can try it on your own. Try it on your own hands. If you just reach, go as high up towards the hand, try to get as much of that proximal phalange first, and see how hard you can squeeze. You can squeeze as hard as you possibly can. And you keep working your way out. And I try to focus on each segment of the phalange. Squeeze, squeeze, squeeze. And I work my way out. Now when I do that on a person's hands, I'll do thumb and pinky finger, then second and fourth, and then the third or middle finger and the thumb again. And that's the way I work on fingers, is through that squeeze action. And just real thorough as I work my way through. My hand in between is creating a stretch into abduction. Now, if I need more to occur there, this is the biggest distinction I have to make for you is not to be pulling. You don't need to be doing a lot of like aggressive tractions on fingers. I know sometimes people like to get the fingers to pop and all that, but you really don't need to be doing that. That's where you should be more cautious, is traction. Traction is a little bit of a cautionary thing. But I could be holding this, and that squeeze, if my line of fingers is around that joint that is creating a minor bit of separation, and then I could just hold that and have the person do what? What can fingers do? So, flex, extend. So feel that a little bit on yourself. As soon as you start doing the action, it feels like more is happening, right? And your hand, the therapist's hand, is acting as a point of resistance in either plane of movement. So something needs to shift there. Sometimes the tendon is just upset or stuck. Like you have 4 tendons they have to like shoot down through here. So that holding of the squeeze and having a person just do the small controlled actions is a really good place to start. If you do that for the fingers, you do the stuff I said for the palms. You've done pretty much everything here at the intrinsic structures of the hand. That's starting out in a very safe way that fits nicely in a massage routine. That's where I tell you to begin. After that, when you're really talking about the wrist, you should be thinking pretty much the forearm up to the elbow entirely. Directly around the wrist, it's all very tendony. There's nothing there to really do anything to. Unless there's been a surgery or injury and there's scar tissue here, then I understand trying to free up the scar tissue. But in terms of working on a release for a muscle or something, there's very little here that makes sense for me to say for a beginning massage therapist to go after. It's just tendons and tubes that don't need to be mashed on. So stay a little bit more cautious related to the wrist. What you can think about is a squeeze action around the wrist joint in general, and that's where identifying the bony landmarks of the structures that actually make up the wrist. So we have the radius and the ulna. The distal bony hooks there are the styloid processes. You'll see them kinda. They're not as big, but they have, I don't think I have it on this too good. No, but you'll palpate them. It's very easy to find. It's the two bony elements that you find on either side of the wrist. That's the styloid process and lateral styloid process and medial styloid process. Yeah. Down here at the ankle, you palpate the same things. It's just they're bigger, more structural. And that's going to be the lateral malleolus, medial malleolus. These are the ends of the radius and ulna. These are the ends of the tibia and fibula. So the styloid processes and the malleoli are pretty much, they are mimicking and correlating with one another. If here, I can apply a squeeze, not a tug, around the joint line. The squeeze will traction it a little, and then I can have a person do what? All the actions that the wrist can do. Now the wrist is a modified condyloid joint, so it's not like a ball and socket joint, but it can basically do everything. But break those motions down a bit more precisely. It's going to be flexion, extension, radial deviation, which would be similar to abduction, but it gets called radial deviation, ulnar deviation. It's a frontal plane movement, so it's okay to think of it as part of abduction, but it's named, I'm sorry, different. I really wish it was just named that. But identifying even between just those four actions, which one feels more problematic? Which one, as they try to do it, feels like they have more of a struggle and resistance to? You just holding that and them doing the actions are already doing something, already accomplishing something. So, but break the things down. Don't go just to doing circles. Flexion, extension, radial deviation, ulnar deviation, then circles in one direction and then the other direction. That's interfacing with how all of these tendons and muscles create actions at the wrist, and you're being able to, one, by being more precise, you're focusing attention at each one of those individual structures, but assessment-wise, you can start figuring out which one of these actions is actually part of the problem. Which one feels like it's too much? That means you got to go find the stuff that causes that action and get it to let go. Find the stuff that's too weak and maybe prompt that to get a little bit more active. Usually you're fine to initially concentrate on what's too strong. And it would be real common for you to find a person that can do plenty of flexion, plenty of ulnar deviation, and they need more of extension and radial deviation. But by just releasing here, you'll accomplish a lot of that. See, I can kind of show. I'll get my hands here and the squeeze and a squeeze. I can't quite get there. That would be assessment. If I can't get their fingers to abduct, that would tell me something. All right, there's a problem. Around the wrist, the way that I do this, it's the one time that I do use my thumb a little bit. But I use both hands, good squeeze. This way I'm not squeezing along the carpal tunnel. Right? Here, and then the person does the actions as I coach them. Sometimes I have to show people, take their body and say, I want you to do this, and this, and this, and this. Rather than just trying to verbally describe it. You know, just you have both hands on them anyway. Like this one, all right, go. And then my palms can create resistance. So even if the action to end range is uncomfortable, they're gonna push into flexion into my palm. I can make it be isometric. I can have them activate without causing a big range of motion change. Okay, let's work our way up. And let me stay at the ankle. That's what I have to say. And I just scratch the table. Be careful. The ankle. Now the foot, we've talked plenty about sideline and shown the merits of that, right? In prone, which I'm mindful of, this is how most people are going to be starting for you. They're going to be like this. So let me try to couple that idea in. Where in prone for the hand, you can see those big muscles. The tendons, they have to shoot through the carpal tunnel and come down. In terms of identifying that just visually, if the tendon splits and goes to multiple digits, then it has to be a digitorum something. If it's on this side, it's a flexor digitorum. If it's on this side, it's an extensor digitorum. If it goes to an individual joint, then you know it has to be named for that specific joint. So that's going to be a flexor hallucis. And I could chase that tendon all the way up, and there's going to be a flexor hallucis muscle. And there's intrinsic ones, but then a lot of the really easier to access muscles related to the hand, they're here in the forearm. Over here, extensor hallucis, extensor digiti minimi, flexor digiti minimi, and on you go. Pairing that up with the muscles of the foot, we talked about the thenar and hypothenar muscles of the hand. Those are the biggest ones intrinsic to the hand that are easiest to get to. Internally, there are the lumbrical and interosseous muscles, which are related to the abduction and adduction actions. Because that's not happening here. That's happening here. You also have those deep in the foot, lumbricals and interosseous. The way to interface with those, we talk about working on individual digits with the toes, little toes. Sandy is brave enough to actually lace her fingers in between the toes, and that sometimes feels a little bit aggressive for me, but it works really good for others. So if the person's foot is big enough, your hand is small enough, that can be a pretty good way to create some stretch of those toes and then move them around through range, especially the small ones. The big toe is easy to get a hold of and move. Beyond that, you can grab them individually. I'm more prone to grabbing them like this, all 4 fingers for the 4 little toes. And then I roll them around like that. And if I have to, try to create some spread. But as I said, the spread doesn't happen here at the phalangeal joints. It happens up here in the metacarpals and the metatarsals. The way to help with that is going to be more the shear actions. So we want to do a good foot massage. We want to do a good hand massage. In prone, is where using the soft fist is so useful. My knuckles are going to be set in such a way to be concentrating at various times at aspects of that thenar group. This hand's going to come around and, one, protect the thumb joint itself, but with my fingers, I'm going to be on the other side of the thenar group to create some counter pressure. And now they're getting sandwiched between the knuckles and those fingers. I can hold that for a good long time. It's not too much stress on either one of my hands. And there you go. And we can work our way out. Now, as I work my way out, though, if I line my knuckles up with each metatarsal, or trying to be between each metacarpal, as I apply pressure on these three, but not those two, that's going to create a bit of shear. So I hold the thumb, squash all of the hand. I put my fingers under the second metacarpal, the index finger, squash that'd be the medial side of the hand. Then I keep going. Eventually I just am squashing what feels like the pinky side of the fifth metacarpal. Now I've created little shear forces in between those bones. And it feels really good. Doesn't take a long time, but it's a way where I can be doing a pretty fast, efficient hand massage, but be getting a lot more of effect directly related to function. When we get to supine, that one's really easy. But I'm thinking about where this placement is. I try to be between the fifth and fourth, between the first and second. Little shear. Come back over. Now I'm going to be between the first and second, second and third, between the fourth and third. Little shear. All right. With the foot, same thing. If I can create those shear effects at the metatarsals, that's going to create more of an actual effect. Now, there's a few options I have. In prone, I really try to stress working on the foot in prone as a way to hurt yourself. If somebody's short, you're going to be reaching. If they're laying weird, it's hard to get to, you're going to screw up your body mechanics doing this. Grabbing a hold of the calcaneus. Plantar fasciitis is a common symptom. And a way to work on that is not to push on it directly. That's a tendinous attachment, and it will be ouchy. All that's really here, soft tissue-wise, is more like this kind of the added fat pad and some extra layers of skin to create cushion for when you land on it. So I know it feels to me like mine is just getting squashed too much, and particularly with anybody that's on their feet for whatever reason, but the athletes in particular, plantar fasciitis was a really common problem. The thing that I did that at least felt really good, whether or not it fixed anything, plantar fasciitis always felt like a 50-50. The stuff I do is either going to help or it's going to make it feel better for a little while, and it's going to keep coming back until you stop jumping all the time. So, but squeezing that heel in such a way that it feels like it lifts the tissue up and away from the calcaneus. It feels great. And it's a way to work on the heel. I use that a ton. I use it as a way to walk around the table. I'm always grabbing a hold of the heels and giving them a squeeze and a squeeze. But the principle being that I'm affecting that tissue in a way that pulls it away from the underlying bone. Because since it's always getting smashed into that bone, I think it would be happier if it was given a break. And it usually is. But now once I have a hold of that, I'm stabilizing that calcaneus. The calcaneus is the biggest of those metatarsals. All the tarsals. Okay. The biggest of the tarsals. And it's talus that actually is making contact with the tibia and the fibula, the malleoli and the tibia to make up the actual ankle joint. And talus is sitting on top of calcaneus. Talus is bumping into navicular, which then begins really the true arch of your foot. If I can stabilize the biggest one and then move the rest of the foot around, then I'm going to create shear forces for those tarsal bones. And I would indicate that you can try to do that here at the hand. It's something that I think happens more inadvertently while doing the compressions. Trying to be precise on the specific carpals is kind of a pain. But that is a place to start considering if there's more regional issues here. You don't tend to see that a lot unless it's like a pisiform. Somebody fell and broke that little aspect of their carpal bone here. It's not uncommon. They fall and they have a little snap there. But I have found I don't find myself trying to shift the carpal bones as much as I find myself trying to shift people's tarsal bones. I find usually if I can get the wrist moving good and the metacarpals moving good, everything else kind of sorts itself out. And especially the application of soft fist along the hand is getting some actions. So, open yourself up to being more precise here if you have to, but I don't find I worry about that one as much as this. So, anyway, grab a hold of the calcaneus, grab this side of the foot, the bar is in my way, so my mechanics are going to be bad, and then just give it a twist. Not to the point where I'm going to, but make that a nice rhythmic. I can make that feel really good because you have the proximal end of the fifth metatarsal. So your pinky toe metatarsal is huge, right? It has some additional, like that bony projection is right here, and additional muscles attached there. So getting a hold around that big fifth metatarsal is important. So I tend to use prone positions as an excuse to grab around that and give the heel a nice squeeze and move that fifth metatarsal. If I walk around, I can do that on the exact same opposite side, but just working on the first metatarsal, the big toe one. So squeeze, grab here. Now it's going to feel like I'm working a little bit in the arch of the foot. I grab right around the ball of the foot, which is just the point where your first metatarsal ends and the big toe first phalangeal joint begins. Now you don't want to push aggressively right there. These are the only two places to not apply too much direct pressure. Is right there on the ball of the foot, because this joint has two little extra sesamoid bones that project out and create a little tunnel for that tendon to go through. So you don't want to push here because there's extra little bony knobs that would hurt as you push stuff into those. Same reason why you don't push too much directly on the heel. But if you grab around it and give it a good squeeze, little rock back and forth. Now we're getting the arch of the foot, which is really the first, second, third metatarsal meeting the cuneiforms and navicular. I'm trying to keep it all sorted in my brain. But that half of your foot, I don't know if you remember when I brought the foot out and showed you kind of how the two halves of the foot are oriented, where on the arch side you have calcaneus meets talus meets navicular, which meets 3 cuneiforms for each of those individual metatarsals. You have a cuneiform for the first, you have a cuneiform for the second, and you have a cuneiform for the third. You have 3 extra metatarsals for the arch side of your foot. On the other side of the foot, talus just bumps into cuboid. Just cuboid, and that is what interfaces with the 4th and 5th metatarsals. All it really matters there is the lateral half of your foot, mostly half, less than half, is more structural. The arch side of your foot, naturally, is supposed to be more about pliability and mobility. And the most difficult issue here is if somebody has what's called a navicular drop, where the arch of the foot is really unstable. Now, like with hypermobility, that's a much more difficult interface because really what they need is more stability. And massage is going to be better at making things looser and more pliable. Flat, think of a little bit like a flat-footed person having a permanent navicular drop. and somebody with too high of arches that's all too short and tight. Both of those, though, need just as much of all of this intervention. I've seen plenty of a giant, amazing athlete with the most flat feet you could ever imagine, and they function okay, but they do tend to, the individuals with feet that are more flat or too high arched, they tend to develop symptoms here. So they need more help here. And if we can help just clean up the stress of dealing with that structural forever issue, then that's going to help the rest of the body. Even if, in many of their cases, over time, with the predominant thing that would be bothering them would be Achilles tendonitis and patellar tendonitis. But if I didn't address the nature of their foot as probably being a contributing factor of causing extra stress to those parts of their body up the chain, then it was never gonna be as effective. There's a lot of words for squeeze a heel, move one side of the foot, squeeze a heel, move the other side of the foot. It'll feel good, and it does a lot. Cool. Side lying ends up being the best position for it because whammo, there everything is finally lined up for us. Where I can brace that lateral side of the foot. Okay, let me do it this way. I always remember that I keep the toes kind of touching my wrist. Here. Now I can really focus that attention in a variety of ways. If I increase my elbow angle, I can get real central and work right up the middle of that foot all the way to calcaneus. Or I can get more medial and be working more directly on something that maybe has more to do with the big toe or is actually traveling up here behind the Achilles. If it's more central, it's just attaching onto calcaneus and it's done. A bunch of stuff though, thankfully, I probably said this enough to you now, that you know there's something underneath the Achilles, and those muscles run between calcaneus and the medial malleolus. They use that as a tunnel. Think of it as the tarsal tunnel, just like a carpal tunnel. That's a tunnel that the tendons come to. This is the tunnel that the muscles that do similar actions use and go to. So this tunnel becomes problematic for people. This tunnel becomes problematic for people, especially when you start coupling the aspect of people getting ankle sprains, stuff like that. So, wow. While I'm there though, I have the added benefit of if I just put this hand here while this forearm is here or this soft fist is here, I can move those toes around at the same time. I could be bending the metatarsals. I can grab onto a big toe and move it individually. While working on this, I could grab onto the small toes, just like this, just pulling back and forth while I'm working here. And that would just create the extra benefit. As we travel up, which I'll try to couple in how we work there, side lying position though for this is the big one. There really isn't a better way to get here. You can try to come in on angles in prone, but it's never you're gonna be reaching, it's bad body mechanics, it's a bad time, okay? But if you had to in prone, you could. I'd suggest get low. In my wrist angle, I can grab and get like the tibialis and fibularis muscles. But if I wanted to get here, I gotta drop down. The goal here usually is to just move all the Achilles-related muscles, gastrocnemius, soleus, and plantaris, shear them off of the underlying muscles. Since it all tends to get tight here, if we can bend it that way, that tends to give me some breathing room. The more aggressive option is to start chiseling between the two. But typically, this is where it is the best action. So if those muscles travel here and go through the arch of the foot, if I put a little compression of the arch of the foot, grab a hold, and just try to open that space up. Right? Just grab a hold and this way. my wrist is not at the best angle when I do that. So usually here you gotta be real, let yourself step really close. I have one time where I'm trying to figure out better angles based on how the client's positioned. It could be stuff like this. But the way I'm getting two effects, where do these muscles end and where do they begin? And more trying to feel like I'm pulling all this surface stuff off in a way. The more aggressive version, and frankly the one that I can modify to make it less aggressive, is using the soft fist, because the angle of your knuckles is already on an angle that tends to match up more nicely here. And if I have to get more aggressive, I shift in such a way where my knuckles are actually trying to get between those two. And that's when I have to, something's really glued and I have to go in with a chisel and try to force it apart. But what I stress here is to try not to do, like there's Rolfing systems and things like that that are all about like, whoosh, come with a thumb or a tool and just glide and force your way up through there. That stuff will work, but it's harder on your body and it is quite an endurance test, sensation-wise. It's more kind and better on your body mechanics to get placed really good here and then incorporate joint movement to create that shear effect. So I can hold my compression here and then passively roll the ankle around. Passively move the big toe back and forth. I pick those two because there's a big toe muscle, flexor hallucis longus, that comes up through here. So even if I just move that one, I'm creating shear forces along this tunnel in between these compartments. Or ask them to do the actions. Pen, have them roll their ankle around in circles, one direction than the other. Move your way up. If they really want results, nothing's going to be better than incorporating active joint movement. So you don't have to be forcing that glide and just carving it. One spot, roll, next spot, roll, next spot, roll. That'll do the same thing. It'll probably be more effective because you won't be having them flinch and having all that pain response. But you're never going to do better here related to ankle and toe function than the sideline position. There just is not a more efficient way. All right, the top foot, inside line. Same thing. Although there's not a whole lot to put like more aggressive pressure in here, this all needs to slip and slide. It needs attention. So in this orientation, I tend to have my hand underneath here, and then the way that looks, and I change how I set my fingers. I can be more broad and gentle, or I can curl and get more specific. I can be thinking about an individual, like a navicular, tarsal, or I could be thinking about the individual metatarsals. So I hold and I brace it real good, and then I'm moving the rest of the foot on over and on top of my fingers. So set my fingers, massage, massage, massage. Wait, set, roll, 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 set, roll, 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 set, roll, roll, roll. And there you go. That's just, it feels really good, it works too good. Voila. Also, here on the lateral and anterior aspect of the leg, remembering that there's two compartments. We have the anterior compartment and the lateral compartment. Each of 3 muscles, so it's not too bad. Tibialis anterior, I take gastroc soleus / plantaris off. Usually these models don't have plantaris included, but gastrocnemius is the only one that crosses the knee. We'll be talking about that one here soon. Soleus is important related to ankle function, but all of those just become the Achilles. Then underneath of it, we have 3 muscles. Directly on the opposite side, so posterior versus anterior, 3 muscles. They're mirror names of each other. Tibialis anterior, tibialis posterior. Extensor digitorum longus, so for all the toes. Flexor digitorum longus. Extensor hallucis longus, flexor hallucis longus. So if there's a problem with one, there's going to be an issue with the antagonist, right? But they're named very nicely for each other here. The forearm is going to be very similar. The lateral compartment, though, either peroneus or fibularis. You have to know that they're both. Peroneus is related to the peroneal nerve that comes down and innervates. Then fibularis, obviously, is just naming it for the bone that they sit on top of. It's in your books as both peroneus / fibularis, but just know that they're synonyms. Fibularis is named so normally that's not hard to remember. It's remembering that peroneus is the synonym for fibularis. But there you just have longus brevis tertius. It's fibularis longus brevis tertius, or peroneus longus brevis tertius. Not so bad, okay? But these are important. They're individual. They have other jobs, mostly about stabilizing the lateral side of your foot for balancing things. Working on those lines, and this will be a common theme here, is if I can, in order to work more efficiently, I need to be massaging as much as possible where there's these intersections and overlaps, so that I'm not affecting just one thing at a time. I want to be pulling one set of structures away from the other. I'm compressing one set of structures and getting them more pliable, but then I'm creating separation and space for the deeper structures. And now we've won the game. Here, they're both pretty superficial. And really, it's just a matter of placement, which ideally, we've already done. If I had the table elevated more, it would all be better for me. But I just need to keep in mind that I have this more anterior group and this more lateral group. The kneading action here is one of the best, because my pull hand can reach all the way around these muscles and be pulling them away from that medial line that we just talked about. So that would be a more gentle version of even creating that separation there. But I have to make sure my hand is wrapping all the way over and grabbing on and perceiving that I'm grabbing a hold of gastroc, medius, and soleus and giving that a pull while I'm creating a counter pressure here. So I'm being mindful of where my pull hand is, and I can be more targeted. I can be here, or I could be pulling right up along Achilles and trying to give that a bend. If there's Achilles tendonitis, that's one of the best angles to give that some, rather than pushing it down here, that's not usually advisable. But giving it a pull and a push back and forth to bend it and get it unstuck from underlying structures. I'm gonna here. Now the palm, it works good. I tend to use this action, but the knees is kind of my first one. It warms everything up and I'm not gonna apply as much pressure. So I go through, I warm everything up. If I switch which pull hand I've done, now I'm up closer on the meat of gastroc. Flip. Yep. There we go. Now I'm more on Achilles. With a forearm though, this hand can still be placed in the same orientation, but that forearm can now be used to either be more precisely on tibialis anterior or the fibularis group. And that's just what it tends to look like. Anterior compartment, lateral compartment. Anterior compartment, lateral compartment. Then I switch my hand placement, hold on to calcaneus, anterior compartment, lateral compartment, smush, smush. And it's just, it doesn't take a lot, it's just being a little bit more precise with, in many cases, what your non-working hand is doing. Because then that'll create a more focused, there's a lot of intention, right? All right. How's everybody's brains doing? This should just reinforce why you were shown to work on things in these particular angles to start with. Because over time, rather than it just being, well, I was told, use my forearm on kind of the shin muscles and sideline. But now as you learn the anatomy more, you can then, with your intention, get more and more precise with it. So let me get you back on. All right. Correlating all of that with the forearm. And here's the thing. The layering of muscles and the memorization of muscles, in my opinion, is the hardest here. The application of massage to be effective is pretty easy. So it's a case where, good enough. There's some hacks for memorization. The flexor side, the anterior side of the forearm, has extra stuff. And in general, just remember that. There's more here than over there. Most of the names do parallel, where there's extensor digitorum here, there's flexor digitorums here. Now those big ones are gonna come all the way up, though, right? And they're gonna meet at either the common flexor, as a common flexor tendon on the medial epicondyle, or as the common extensor tendon on the lateral epicondyle. And anybody remember what the medical name for tennis elbow or golfer's elbow would be? Huh? All right, lateral epicondyle, say it with me. Lateral epicondyle, medial epicondyle.
Medial epicondyle.
Medial epicondyle. Those are the roundy, bony bar bits at the end of the humerus. Funny bone. Okay. Medial epicondylitis is golfer's elbow. Epicondylitis, just like patellar tendonitis. Itis, ow. Inflammation. So golfers, at least I think if we're talking about the right hand in this action for a right-handed person, the golfer is going into a medial internal rotation adduction action. So medial with golfer, but a tennis player would have a backhand. So tennis elbow is lateral epicondylitis. What's usually happening there is, yes, there's something related to elbow function, but it's the common extensor and flexor tendons that attach past the elbow joint that are more about grip and wrist action, right? What does a golfer do? There's a lot of a hard pivot and swing. Like the fine action of being precise in those sports is at the wrist. So it's like a little bit of a supination action and all of that, right? The symptoms manifest here. The cause of it tends to be more about what's happening here. But the muscles are up there. Thus meaning you just got to squash all of that half and be really thorough. There's the more proximal half and the more distal half. The more proximal half, the more distal half. And in many parts of the appendages, this is really a useful device to think about. Even here, one muscle, bicep brachii, but it can do two actions, elbow flexion and shoulder flexion, meaning the fibers nearest to the elbow are more neurologically associated with the elbow. The fibers nearest to the shoulder are more neurologically connected to the shoulder. But since it's one muscle, and many times we're doing those actions coupled together in some kind of way, it gets confused. And the elements between those two, the transition from one part of that job to the other, can get messy and cause problems. So It can be that we're talking about multiple muscles or even one muscle related to 2 or 3 actions. With biceps, you're going to hear the exact same thing about the hamstrings because they're about knee flexion and hip extension, which is even more confusing. The biggest issue here is that these tend to be way too long for people. This part's too short, but we can't think about the hamstrings just as one thing. There's the 3 individual muscles, but then there's also thinking about what actions are involved. Is it about the knee? And if we're talking about the knee, then we gotta be at the stuff closer to the knee. If we're talking about the hip, then we gotta be about stuff closer to the hip. But the hamstrings can be dealing with both. And if a problem occurs in one, it's gonna cause a problem in the other. So it can be a case where even this kind of stuff, if a problem starts at the shoulder, could manifest and start causing things in the elbow, an adaptation that occurs here in these forearm muscles. Somebody gets lateral epicondylitis, tennis elbow. We initially have to clean this up, but we find that there's something weird happening up here that is probably the true causal element. Sad truth too, you'll never know for sure. The breadcrumb trail, it gets eaten by rabbits. there's no knowing for absolute certain the direct chain of events, right? You have to make very mindful guesses, connect into some kind of spirit guide and, let them guide you. But you have to be making educated guesses and then trial and erroring your way. Now, here's going to be the nice part. I already said around the wrist, you have to be careful. So not any really hard direct compressions here. When we're working, like using a forearm or something, that's where you got to lighten your pressure up. But that's where need actions. Get those tendons to bend, but don't smash them down. Same thing here. Get them to bend. You should massage here, but I tend to say if you're going to pick a direction of force, it's that. Go that way across what is close to the wrist. Get those things to slip and slide. Here, deep, you do have an extra pronator muscle. Now, getting all the way to it is a journey that I don't usually suggest. Thus why if you just push the surface stuff across it, we can create some shear. You have another pronator up here, 2 pronators versus 1 supinator. Guess who wins? Now your biceps also supinate, oddly enough. So there's other helpers for supinator. But starting deep, come here you, let go. Getting all this stuff off. Like the extensor side's not so bad, but you just keep going on these forearms. There's so many layers on the flexor side, anterior side of the forearm. And what we usually need to at least get to is that second and or third layer. We don't have to push all the way to the point that we're mashing these delicate tubes into the skeleton. So it just ends up being, while you're working on the forearms, be mindful that you're not always hitting it in the exact same orientation, leaving the hand and the arm set in the same place and applying your pressure in the same place. Are you working central? Are you working medial? Are you working lateral? It will be the same glide. It'll be the same need, but you need to be a little bit mindful that you're hitting at least that, getting particularly the lateral and the medial aspects of the forearm as well as the central line of the forearm. Just doing that will take you far. The muscles named on either side that tend to get people a little bit, the flexors and extensors, they're named pretty, like that makes sense. Pronators, makes sense that they're on this side, right? Supinator, makes sense that it's on that side. Then you have muscles named for the bones, and at least they mirror each other again. Flexor, what side of the forearm would that be on? Versus an extensor. Okay, so always the anterior side of the arm is going to be a flexor, posterior side of the arm, extensor. Extensor carpi radialis. What side is the radius on? Now, since it's on the radius, is it going to be central, medial, or lateral?
Lateral.
It'd be lateral. So if their action is related to this that hurts, maybe there's something going on with a flexor carpi or an extensor carpi radialis. Flexor, extensor carpi ulnaris. Cool. Because that's a big one. Your shoulder and like wrist, elbow stability, but then secondary to that, your ankle stability is really essential. And there's a lot of metrics out there showing that the longer you can sustain one-legged stability, the longer you will live. So I swear that it's a real metric. So the longer you can stand on one foot, the longer you'll be here. All right. We talked here how to be efficient on the lower leg. Not too difficult. Once we get to the knee, we'll talk a bit more about gastroc and all that. With gastroc, really the biggest challenge tends to be, do you get also the medial portion of it and that central line of it? Because when people lay prone, you're stuck lateral. If you use sideline, you don't have that problem. The forearm does get people though. And with that, it's a reason why you see me make some choices body mechanics wise. There's the common extensor attachment. That's the lateral epicondylitis. Now they're laying like this, so everything gets flipped on you. I get my palm. All I have to do is find that bone. Can you find the end of your humerus? Okay, now once you find that, you should feel that there's like a bony chunk there. Some of that is brachioradialis sitting on top. But if you make a fist, you should feel that kick on really good, right? Make a fist, and you feel it. Rah. Okay, that's where those are. If I can just get my palm, it sits really nicely right over top of that. And then real slow. Ideally, I've warmed everything up. I tend to use kneading as my surface warm-up thing, and then come in and I'm more thorough. And that's why I'll stand like this rather than like this, because this orientation puts me more right on top of that common extensor attachment. Once I'm here, I'll do the same thing when they're the forearm like this. I'll switch my body mechanics rather than the pelvis being open to the table. So I can be more precise. Yep. No. Talking about extensors anyway. But just this is actually the biggest hack. This is a lot of word salad for just being like, if you stand like this, arm off to the side, get the arm close to the edge so you're lined up good. Make sure you are right on top of that. And guess what you get to do? You don't always have to be certain all the time. Have a person make a fist. You feel that kick on, you're like, okay, there it is. Get yourself set on it, and then work your way down and be thorough. This is the important half though. This is where you gotta be real concentrated, because up here, you're on top of the attachment site, and a big part of the meat, the belly of these common extensor related muscles. Directly underneath that is supinator. So you're in a position where you're sitting on top of just so many layers that tend to get stuck together. If we are here and we hold, and then I have a person do rotation or especially supination related actions, then we can try to get that unstuck. But one of the easiest things here tended to be for me to start out, just, is to really slowly glide. I warm everything up. Doesn't take long. Just massage, 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 and then squash to pressure, preference / tolerance. Like, okay, make a nice strong fist. That's a nice isometric action that activates everything. And even if it's a little bit ouchy here, that'll kind of positional release / it'll push you up out of the way. And then so good long, strong fist. They usually have too much strength in. Then Open your fingers. Bring your wrist up. Okay, good, stop. I'm just holding this. Make a fist. Relax. Spread your fingers. Bring your wrist up. Okay. Now, roll your wrist in a circle. One direction. The other direction. Cool. Now just wiggle your fingers around. Play piano. Crazy wide variety of directions. Doesn't matter what it is. I use that for musicians, for basketball players, for dental hygienists, and I would just do that as I worked my way down. From the attachment, and worked my way down, and kept on chasing the spots that felt more tonic. Once I found something, held, same actions. As I felt which actions caused what I was pushing on to activate, I could be more aware of maybe exactly what those muscles were. Because it's really hard to identify, they're so spindly here. But then you can go, wait, that definitely activates a lot more when they move their fingers versus their wrist. So I would make them do that more. Or the following sessions I could be more precise. The other element here is to occasionally watch a little bit at the attachment. So once you're off of that, you can start moving them around more. But get your hand placed a little bit differently. All it takes is from being this to this to be a bit more lateral. To occasionally see, well, you know what, maybe I don't feel as much here. Maybe I should come over here and get more medial. Or maybe I find that better doing it this. And that tends to be where I get that part. If I'm real thorough with my needs, you concentrate along this line. And then come down. It's pretty good. And then just incorporate a variety of actions. And as you're doing it, you're already changing stuff. But as they're doing those individual actions, you're able to assess which movement and function is really more problematic for them. And then you're there. The same thing with the forearm, the anterior forearm. As long as we, if I can actually get this back in place. It's real persnickety. There we go. So here, if I kind of hold that elbow, then I can rotate them a little bit. And I can hold, and I can be real central, and roll a little bit, be more medial, be more lateral, more lateral. Maybe I need to step a little bit to the side like this, and then I'll be more medial. But that's how I was super thorough on forearms. That's what made me a game changer. It wasn't that I really changed anything, it's just I got really good at realizing this half is important. Squash, do all the hand motions. Okay, halfway, done. Come back up, a little bit lateral, again. A little bit medial, again. A few more needs, and that usually took care of most of the issues, to be honest with you. Being more and more thorough over the following sessions. Then you can start being like, this is definitely about your pinky finger. I gotta focus on that. But where would the pinky finger muscles be? Would they be over here or over here? So I never went, I'm going to find it and it's there. I would say, okay, move your pinky finger for me, slowly back and forth. And I would just kind of slowly compress until I finally felt it acting. And then I would know I was on it. And then they're already doing the action, so we're already doing the muscle entry technique. And these finer, tiny parts of the body, and in general, having the person perform the action is a way for you to palpate and find the individual muscle. All right.